Good afternoon, everyone, and for today's presentation, we're going to be talking about the U.S. healthcare system. My name is Andres David Hurtado, and for any questions, please hold them for the end of the presentation. The U.S. healthcare system and the history. Can we manage as they did in the past? The medicine in the 1700s, shaping the healthcare system, and learning from past tragic events. One would never imagine a world as we live today with primitive medicine, and with all the known diseases and illnesses, how could we survive? That's how the history of healthcare was in the 1700s. A primitive but yet sophisticated conducted by Native Americans with a selection of herbs that contain medicinal benefits. As a consequence, history and healthcare started to take shape with President John Adams signing the Marine Hospital Fund into law on July 16, 1789, derived from the first Marine hospital with programs to cover health matters and disable soldiers. Another chapter to its history of health was the impact of the Civil War, not only increasing its size, but new techniques were created which led to a better understanding of medicine and disease to a point that modern medicine was slowly evolving. What shaped our healthcare system? Technology as a healthcare backbone, social development in the healthcare system, and how legal policy and procedures can influence the system. One of the influencing factors over the past 50 years is the advancement in technology. From the arrival of corporate care, it was the beginning of many organizations using its networks to expand its medical devices as an advertising to reach the consumer, meaning that it led to a confident era in which technology was the solution to many diseases and infections. This impact comes to acknowledging that technology plays an important role in our life, in our healthcare system, through new equipment that have changed the course of the system. But as the costs go, it keeps getting more expensive to buy such equipment, increasing the costs for the treatment. Social development brought many factors in transforming our healthcare system. One of those are the creation of the Red Cross by Clara Barton in 1881, who established a foundation assisting the wounded soldiers during the Civil War, and on this day is growing stronger than ever, and its members keep assisting as volunteers. Legal policy and procedures plays a huge role in our healthcare system, in which make it possible for many programs from federal law and state to increase the quality and access of the care of the patients and benefiting the providers. And one of those are the electronic health information tool, which allows exchange policy and contracts between providers, facilities, and health departments. Stakeholders, roles, and difference within the system. Stakeholders, healthcare professionals, clients, and how providers and clients differ. Stakeholders are the complete puzzle of the healthcare system, because when all their elements are together, the system can function. This is partly composed by healthcare providers under their patients. The healthcare providers are those providing the service. It can be either through an appointment for a regular routine checkup or through a pharmaceutical and get a refill on a prescribed drug. On the other hand, clients are in the need of the provider to make sure their health is good and not let any delays worsen the situation. Something is really worse. Providers and clients differ from within the system in their perspective towards the health provided and received. Many would think both sides are in agreement, but the truth is that the client can have tremendous power over the provider if they choose to go somewhere else. If the current provider does not change the quality and access for the care required by the client's need, he can go the other way. Stakeholders' roles and difference within the system. Political figure influence in the system, schools, and the benefit of education. Political figure plays another role in the system. Together with culture tech have been taking shape the care and quality of its service. The roles can be easily noticed by the past accomplishment for research and funding to many programs, and one of those are the Lasker Foundation, promoting research to find cancer. Furthermore, this has led to political pressure to open more research towards female health issues. This makes it different from the other stakeholders due to its direct approach in the system. The schools are introduced to the public health laws for better understanding the system and the reasons behind them. This approach within the system creates an important role since it can target the problem at a younger age by preventing disease of the children are educated on how to care of themselves and their health. Not as direct approach like a political figure would do, but it can be seen as an indirect approach by making educational than just pressure the children to learn. The cost of the healthcare system. Public health insurance. In the public health insurance, we have Medicare, Medicaid, and other public systems. Medicaid is offered to low-income and disabled people, but the access to other cares is very difficult since many enrollees have trouble in finding providers accepting Medicaid due to its low reimbursement rate. For Medicare, on the other hand, is a federal program offered to people 65 years old age and over, and some disabled individuals. Even though it has several parts to separate services like Part A that covers hospital services or Part D that offers prescription drug benefits, there are gaps in the coverage, like incomplete coverage care, no coverage for dental, hearing, and vision. The cost of health association continued. Private health insurance. We have the employer-sponsored insurance and we have the private non-group. In the private sector, we have the employer-sponsored insurance and the private non-group. The employer-sponsored insurance represents the main way in how Americans receive health insurance, included as a package for working for their companies. The cost will vary depending on the type of insurance they are covered in. Some may be covered prescribed drugs and others may not. The private non-group covers part of the population that is self-employed or retired, paying premium out-of-pocket coverage, with the risk depending on the individual's health condition, and as the employer-sponsored insurance, it will depend also on the type of health insurance the member is enrolled in. Technology against the system. We have affecting the cost and affecting delivery of quality care. Technology has brought us many great ways for professionals to do their job more efficient, but it has affected the system by every new equipment. There has been an increase in the cost, so it seems that technology is working against us, but not in all aspects. This can be very confusing because we all can agree that technology has helped everyone, but the cost does not seem to go down. On the other hand, the delivery of care has been increasing thanks to the new equipment available to the patients. Through their premium, they can choose, request as specialists who can handle the type of equipment needed to either diagnose the problem or come to a solution if no further inquiries are required. Healthcare system around the world, Colombia versus United States. How Colombia accesses healthcare and how do they pay for healthcare? There are two types of healthcare system in Colombia established by Law 100, consisting of two parallel plans: contributory health plan for those citizens who are able to pay, and a subsidized health plan for those who are unable to pay. The population is divided, conducted by a survey in order to decide in 6 sections, from the poorest 1 to 2 to the richest 3 to 6. With this in place, the ones in contributory plan will contribute a certain amount from their salaries to maintain the system. On the other hand, the state will cover the costs corresponding to those in the subsidized plan. How the United States accesses healthcare and how do they pay for the care? In the United States, we also have a private and public access to the healthcare system, but with the difference in that they don't only can get an insurance plan on their own, but also some companies offer premiums for health coverage to keep personnel working for their companies. Also, another difference and uniqueness of the system in the United States is the dominance of the private element over the public element. Quality and service in Colombia versus the United States. What is the quality of the healthcare they receive? Are there unique services provided? Pros and cons of the system. The quality of the healthcare system in Colombia depends greatly if you have the money to cover for your own expenses, or depend from the state to decide what it will cover. In the contributory plan covers all illnesses and health problems, while the subsidized plan leaves out many services towards illnesses, leaving the majority of the population in poor conditions or out of luck. A unique service that both plans work on is that they use third-party entities to manage the budget, and as it goes by demand, instead of having set a huge budget, they will go by the number of invoices to get paid. The pros of the system is that it's available for everyone, and the reason that many are missing the plan offered by the states is due to the lack of surveys to account for those families in need of health care. Also, it has been kept alive expectancy after birth for males to 72 years of age and females for 78 years of age. The cons of the system is that it depends greatly on how much you can afford in order to receive the best care. Difference between Colombia and the United States healthcare system. We have the budget and diversity. Diversity is not as common as the United States, which we can use an advantage to ease the problem and increasing the workforce in the field. In the budget situation in Colombia, it depends greatly on the contributions of the workforce to sustain the system and money charged by public hospitals for services rendered. Also, mismanagement is a huge cause of the flaw in the system. Unlike in the United States, there has been many ways to get the population notified and how to enroll for free through the Obamacare. Reforms and improvement. Better understanding for Medicare for beneficiaries. Improvements on the program for patients. Mental health services can be very difficult to understand, but by taking the time to interpret its policies, it can be more productive and easy to understand, which regulates who is entitled to mental health benefits and how, when, where, and why the services may be delivered. Furthermore, in this field, it's not offered training from psychology school in how to run a facility like this, where improvement needs much more focus, since it can lead to the overcharging its patient for some the professionals are not supposed to get, meaning that the medical reimbursements method needs to be implemented on training new generations on how to run a facility of this kind in order to be able to do the right billing code for the service. If there's any questions or concern, please don't hesitate to ask. Here are the following references for the scholarly sources that I use for my presentation. Thank you very much and have a good day.